Nurse Aide Test Prep Discount. Question 1. A client with dementia has a tendency to wander. The nurse aide should: Option A, place the client in a locked room. Option B, provide a safe wandering area. Option C, use restraints. Option D, ignore the behavior. The correct answer is option B, provide a safe wandering area. A safe, enclosed area for walking addresses the need to wander safely. Locked rooms and restraints are restrictive and require orders. Ignoring the behavior is unsafe. Question 2. The proper body mechanics for lifting includes: Option A, lifting with the back. Option B, lifting with the legs. Option C, twisting while lifting. Option D, lifting with arms extended. The correct answer is option B, lifting with the legs. Lifting with the legs, bending at the knees, keeping back straight, uses the strongest muscles and prevents back injury. Lifting with the back is a common cause of injury. Twisting while lifting puts torque on the spine. Question 3. A client with a pulse of 112 beats per minute is experiencing: Option A, normal heart rate. Option B, bradycardia. Option C, tachycardia. Option D, arrhythmia. The correct answer is option C, tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 4. Normal adult resting heart rate range is: Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 80 to 120 beats per minute. Option D, 100 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 5. The nurse aide should speak to a client who is hearing impaired by: Option A, speaking very loudly. Option B, speaking slowly and clearly while facing the client. Option C, writing everything down. Option D, asking a family member to translate. The correct answer is option B, speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical. Question 6. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A, feed the client quickly. Option B, provide verbal cues to chew and swallow. Option C, puree all food. Option D, remove the food after 15 minutes. The correct answer is option B, provide verbal cues to chew and swallow. Verbal cues, example, chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 7. The nurse aide's responsibility with advanced directives includes: Option A, helping the client complete advanced directives. Option B, honoring the client's wishes and informing the nurse. Option C, making decisions for the client. Option D, explaining advanced directives to the family. The correct answer is option B, honoring the client's wishes and informing the nurse. The nurse aide must respect and follow advanced directives and inform the nurse of any issues. The aide does not assist in completing advanced directives, make decisions for the client, or explain legal documents to the family. Question 8. When communicating with a client with dementia, the nurse aide should: Option A, use complex medical terms. Option B, use simple, one-step directions. Option C, speak loudly. Option D, ask open-ended questions. The correct answer is option B, use simple, one-step directions. Simple, one-step directions, example, please sit down, are most effective. Complex terms, open-ended questions, and loud tones are overwhelming and may cause agitation. Question 9. How should the nurse aide communicate with a client who has a hearing loss? Option A. Face the client when speaking. Option B. Repeat the statement. Option C. Shout so that the client can hear. Option D. Use a high-pitched voice. The correct answer is option A. Face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy. Question 10. What is the first sound heard through the stethoscope when taking blood pressure? Option A. Diastolic pressure. Option B. Systolic pressure. Option C. Pulse pressure. Option D. Pulse deficit. The correct answer is option B. Systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 11. When measuring output, the nurse aide should record. Option A. Urine only. Option B. Urine, diarrhea, and vomitus. Option C. Diarrhea only. Option D. Vomitus only. The correct answer is option B. Urine, diarrhea, and vomitus. Output includes all fluids leaving the body: urine, diarrhea, and vomitus. These are all measured and recorded to monitor fluid balance. Question 12. A client with dementia is pacing and appears anxious. The nurse aide should: Option A. Restrain the client to prevent falls. Option B. Encourage the client to sit down and rest. Option C. Walk with the client in a safe area. Option D. Leave the client alone. The correct answer is option C. Walk with the client in a safe area. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Pacing is a common behavior in dementia. Restraining increases agitation. Forcing the client to sit may escalate behavior. Question 13. When is alcohol-based hand rub acceptable instead of soap and water? Option A. When hands are visibly soiled. Option B. After using the restroom. Option C. Before touching a client with clean hands. Option D. After caring for a client with C. diff. The correct answer is option C. Before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 14. A client's blood pressure reading is significantly different from the previous reading. The nurse aide should: Option A. Ignore the difference. Option B. Recheck it after 1 to 2 minutes. Option C. Change the client's medication. Option D. Document the first reading only. The correct answer is option B. Recheck it after 1 to 2 minutes. When an unexpected reading is obtained, recheck after 1 to 2 minutes. The client may have been talking, anxious, or the cuff may have been positioned incorrectly. CNAs cannot change medications. Documenting only the first reading without confirming would be clinically incorrect. Question 15. A client has had a stroke and has left-sided weakness. The nurse aide should: Option A. Place items on the left side to encourage use. Option B. Place items on the right side where the client can reach them. Option C. Ignore the weakness. Option D. Restrain the left arm. The correct answer is option B. Place items on the right side where the client can reach them. Place items within reach on the stronger side to promote independence. Encouraging use of the weaker side is appropriate but should not be forced. Restraining is not appropriate. Question 16. To prevent aspiration during feeding, the nurse aide should: Option A. Feed the client lying down. Option B. Feed the client with their head tilted back. Option C. Feed the client in an upright position. Option D. Feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 17. The apical pulse is located at the Option A, wrist. Option B, neck. Option C, apex of the heart, 5th intercostal space, midclavicular line. Option D, elbow. The correct answer is option C, apex of the heart, 5th intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the 5th intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 18. When assisting a client to walk, the nurse aide should walk. Option A, behind the client. Option B, next to and slightly behind the client, holding the gait belt. Option C, in front of the client. Option D, far to the side of the client. The correct answer is option B, next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 19. The nurse aide should report which finding as a possible sign of abuse. Option A, bruises at different stages of healing. Option B, bruises on the shins. Option C, a client who is hard of hearing. Option D, a client with memory loss. The correct answer is option A, bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 20. A client who is anxious and pacing should be: Option A, placed in a chair and restrained. Option B, encouraged to talk about what is bothering them. Option C, given a sedative. Option D, ignored until they calm down. The correct answer is option B, encouraged to talk about what is bothering them. Encouraging the client to talk about their concerns helps identify the cause of anxiety and may provide relief. Restraint is inappropriate for anxiety. Sedatives require a physician's order. Ignoring them leaves them to suffer alone. Question 21. When a nurse aide is floating to a different unit, they should: Option A, refuse to float to an unfamiliar unit. Option B, accept the assignment but only do familiar tasks. Option C, accept the assignment and ask for orientation to the unit. Option D, accept the assignment and perform all tasks independently. The correct answer is option C, accept the assignment and ask for orientation to the unit. Floating is normal, but the aide should request orientation to the new unit. Refusing may be insubordination. Doing only familiar tasks may not meet client needs. Question 22. A client tells the nurse aide that they want to harm themselves. The aide should: Option A, keep the information confidential. Option B, tell the client that they are being silly. Option C, report it to the nurse immediately. Option D, promise the client that everything will be fine. The correct answer is option C, report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 23. When a client is being discharged, the nurse aide should: Option A, assist with packing and ensure the client has their belongings. Option B, tell the client to call if they need help. Option C, let the client pack alone. Option D, rush the client to leave. The correct answer is option A, assist with packing and ensure the client has their belongings. The nurse aide helps ensure the client has all their belongings and assists with packing as needed, promoting a smooth, dignified discharge. Rushing is disrespectful. Question 24. When assisting a client with a bath, the nurse aide should: Option A, bathe the client from cleanest to dirtiest areas. Option B, bathe from the feet up. Option C, wash the perineal area first. Option D, use one washcloth for the entire body. The correct answer is option A. Bathe the client from cleanest to dirtiest areas. Bathing from cleanest to dirtiest, face first, then upper body, abdomen, arms, legs, and perineal area last, prevents spreading microorganisms. Using one washcloth for the entire body is unsanitary. Question 25. How long should a nurse aide rub hands together with soap and water during hand washing? Option A, 10 to 15 seconds. Option B, at least 20 seconds. Option C, 30 to 40 seconds. Option D, 1 minute. The correct answer is option B, at least 20 seconds. According to CDC guidelines, hand washing requires at least 20 seconds of vigorous rubbing to remove transient microorganisms. 10 to 15 seconds is insufficient. A full minute is not required for standard hand washing.